if you could start the recording now. Hi, Jeremy. Can I get a confirmation that the recording started? Thank you.
Yeah, sorry, I was muted. Yeah, it's
Oh,
live on YouTube and it's recording now as well.
okay, thank you. And Michelle and Stephanie, I see that we do have quorum. So if you want to start up the meeting, that would be great.
Sure. Good morning. My name is Michelle Jameson, and I am the co-chair of the COC Continuum of Care Committee, along with my co-chair, Stephanie Smith from Native American Connections. So today, two of our COC funded providers, ABC and HSC, requested changes to their representation on the COC committee. And so it's Vanessa Carthel will now be the COC committee representative for ABC, and Richard Cruz will now be on the COC committee for representative for HSC. So please, Vanessa, would you like to introduce yourself? Is she on? Okay. What about Richard?
Hello, everyone. My name is Richard Cruz, Director of Programs at the Human Services Campus. Somewhat still new to the role. Been here since June 1st. Looking forward to participating in the call and building as a part of all of this great work that you all have been doing. Thank you very much.
Thank you. Thanks, Richard. And I just put you on the spot, but welcome and nice to meet you. And Ty Rosensteel also said welcome and nice to meet you. So welcome to our team.
And Madam Chair, I see that Vanessa has joined us as well.
Oh, okay, wonderful. And Vanessa, would you like to introduce yourself?
Yes, hello everyone. I'm very glad to be here. My name is Vanessa. I am the Director of Housing at ABC, and glad to see my old colleagues from UM on the call as well. So thank you for welcoming me today.
Welcome. Glad to have you. All right, so now we will be taking the roll call, starting with Stephanie Smith.
Hi, everybody. Good morning. My name is Stephanie Smith from Native American Connections.
Thank you. And then thank you. And I didn't mention, but please introduce yourself, indicate which organization you're with as well. So Vanessa Carthel, we've just talked with her, but I think we can go on. Adrian Clark. Are you with us, Adrian? Okay. Richard Cruz. I know you're here, Richard.
Present.
Okay. And Kathy Denalfe. Okay, she did say she might be a little late today. Alfred Edwards. Alfred, are you with us? Dolores Ernst.
Good morning, everybody. This is DC Ernst. I'm with the City of Phoenix Fire Department Crisis Response Program.
Okay. Wendy Johnson. Anne Marie Johnston.
I see her name.
This is Anne Marie Johnston.
She just unmuted.
Oh, good. Okay, great. Thank you. Laura Magruder.
Laura Magruder, Maggie's Place.
Hi, Laura. Jennifer Page.
Morning, Jennifer Page from Mercy Cares here.
Thank you. Erin Rain. Erin. Nikki Ramirez.
Hello, Nikki Ramirez, Chicanos por la Causa.
Nikki. Tama Riley. Ty Rosensteel.
Good morning, everybody. This is Ty Rosensteel with Crisis Response Network.
Ty. Chayla Schuster.
Kayla Schuster, Community Solutions.
Chayla. Sarah Sims. Okay, Laura Scott-Nicky.
Laura Scott-Nicky, Save the Family.
Hi, Laura. And Stephen Stivers.
Daniel Davis, proxy for Stephen Stivers, UMOM.
Hi, Daniel. Okay, and Craig Tripkin. Okay, well, hopefully more people will join as we go. So we'd like also to introduce our MAG staff to introduce themselves. Let's start with you, Steve.
Hi, Steve Dudasik here from MAG and the Maricopa Regional COC.
Thank you. Sarah Kent.
Good morning, Sarah Kent, Human Services Planner with MAG and the COC.
And Brandy Mead.
Hi, good morning, everyone. This is Brandy Mead with MAG.
Good morning. And Julie Montoya.
Good morning, everyone. Julie Montoya, Human Services Planner with MAG.
And Tina Lopez.
Good morning, everyone. I'm Tina, and I'm the Administrative Assistant for Human Services. Welcome.
Welcome. Hi, Tina. And Tara Spiro.
Good morning, everyone. I'm with MAG.
Hi, Tara. And Amy St. Peter.
Hi there. My name is Amy St. Peter, the Deputy Executive Director with MAG. It's great to see all of you. And if I do turn off my camera, it's because my internet connection's been misbehaving a bit, but I'll still maintain the audio. Thank you.
Thank you. Is there anyone else on the call that I missed or would like to introduce themselves?
This is Aaron Rain. I just logged in late. Sorry, I was struggling with the link, but I'm here now.
Oh, wonderful. Thank you, Aaron. All right, so we will continue. For all participants, please mute your phone or your computer when you're not speaking, and please do not put your phone on hold. For all participants, we ask that you please identify yourself when you're speaking, and we will be reminding people to do that throughout the meeting, as we have been advised that this is an important open meeting law. And a final housekeeping, all votes will be roll call votes. So Stephanie or I will call the roll after a motion is made. So now we will move on to Stephanie with the call to the audience.
Thanks, Michelle. Please note that members of the public were given an opportunity to submit written comments relating to this meeting to azmag.gov/comment within 1 hour of the posted start time for the meeting. Any written comments submitted will be included in the meeting record. Were there any comments posted?
There were no comments posted, Madam Chair.
Thank you, Steve. So we will move on to Michelle for approval of the consent agenda.
All right, so committee members may request that an item be removed from the consent agenda prior to the action on the consent agenda, and members of the audience will be provided an opportunity to comment on the consent items. Consent items are marked with the asterisk. So I'll just take a minute to look through the consent agenda, and then we will take an action for approval.
I just had one question on the minutes from the last meeting. On page 3, it should not be a social service block grant, it should be community development block grant. Otherwise, I'm okay with the rest of the consent agenda.
Okay, thank you, Laura. All right, so we'll make those changes. And does anybody would like to approve the December 17th, 2020 meeting minutes?
I approve with those changes.
Okay, thanks, Laura. Do I have a second?
I can
I'm
second.
sorry, Madam Chair, excuse me. It's this item is for approval of the entire consent agenda, not just the meeting minutes, which will stand, we will correct that. So this agenda is for the entire consent, all of the items, not just the minutes. Thank you.
Oh, okay, so then also the updates from the COC subcommittee.
That is correct, Madam Chair. Thank
Yep.
you.
Okay, so MAG
So I
staff will
first the
provide an
consent
update.
agenda.
Okay, so hold on. So then we will now just move to the MAG staff, so they will go over the subcommittee. Is that correct? Updates.
Madam Chair, the way this process works is with the consent items, we all look at it and we ask the committee to approve all of the items. So you would move to, roll call for approval with a, first with a second. That's how the consent process works. Thank you.
And then updates on, so we're going to seek approval from the December 17th, 2020 updates from the COC subcommittee. And then also updates on the racial equity that were included in the consent item packet. Do I have?
That is correct. That is correct, Madam Chair, along with the meeting minutes. Thank you.
Got it. Okay. So do I have a motion to approve the consent items?
I motion to approve it. The consent agenda.
Laura, thank you. Do I have a second?
And this is Laura Magruder. I second it.
Okay, thank you. So we will proceed with the roll call. Thank you all for your assistance there. Vanessa Carthel.
Aye.
Okay. Stephanie Smith.
Aye.
Adrian Clark. I'm not sure if Adrian joined us. Okay. Richard Cruz.
Aye.
Kathy Denalfe. Okay. Alfred Edwards. Okay. DC Ernst.
Aye.
Wendy Johnson. Anne Marie Johnson.
Aye.
Laura Magruder.
Aye.
Jennifer Page.
Aye.
Aaron Rain.
Aye.
Nikki Ramirez.
Aye.
Tama Riley. Okay. Ty Rosensteel.
Aye.
Taylor Suster.
Aye.
Sarah Sims. Okay, she was out. Laura Skotnicki.
Aye.
Daniel David.
Aye.
And Craig Tripkin. Okay, well, thank you. The motion passes, and now we'll go to Stephanie for the next agenda item.
Thanks, Michelle. Next, we will have Amy St. Peter, the MAG Deputy Executive Director, will report on feedback from the CEO Homeless Services Provider Forum that was held on January 6th.
Thank you very much, members of the committee and to the two co-chairs. We appreciate this opportunity to provide an update on the outreach forums that have been held to inform the development of regional strategies to enhance the infrastructure to address homelessness. Your input last month was very helpful as we work to shape that first forum that we've had, and we look forward to your continued feedback as we continue to roll out additional forums. And we hope to have your ideas, your questions today throughout this presentation. The Forum for Nonprofit Leadership was held on January 6th. We had 68 people come. That was fantastic. We're thrilled to get that level of participation. We thank the Regional Collaborative on Homelessness for helping to shape and conduct the event with us. Eric Cole of ASU, and also a member of the Continuum of Care Board, moderated the plenary session. Partners from the collaborative served as the facilitators and scribes in those 6 breakout sessions. We wanted to ensure, 1, that we could be very inclusive, and 2, that we could accommodate small group discussion. And so we had that number of breakout sessions. The discussion of the breakout sessions focused on 2 main questions. First, it was on the expansion of services. We wanted to get a better understanding of where our services most needed, what kinds of services, and then what barriers and opportunities exist in regard to that geographic dispersion of services and assistance throughout the region. The second area of questions came in terms of the infrastructure. We want to better understand what parts of our regional the infrastructure most need to be strengthened, as well as what parts of it are working really well and could be replicated and scaled up at that regional basis. At the end of the survey and after the survey, we did distribute a survey to all of the participants to offer another opportunity for input on these 2 questions, as well as to gather some additional information in general, and then as well to get their satisfaction with the event. To date, 23 people have completed that survey. Housing was identified as the highest priority among services, shelter, and diversion and prevention strategies. The majority of the participants were satisfied or very satisfied with the event. And improvements for future events have been identified, such as sharing the questions in advance to give people more of an opportunity to really think through what those questions are and then come maybe better prepared to jump into that discussion. We're in the process right now of scheduling a number of additional forums with housing developers, frontline staff, and the business community. We are also looking into having forums planned with education, faith, philanthropic, and government leaders. ASU Action Nexus is assisting with analyzing the feedback from these forums to really better understand what are the main findings from these. And then we'll be using this data to really help shape the strategies that will strengthen the region's infrastructure to address homelessness. We will have the invite out very soon for the staff from the nonprofit agencies, and we hope that all of you will help us to distribute that and be able to attend as well. We do ask that people do register with us, even if they have the Zoom link and the password. If we know in advance that folks are coming, then we're better able to assign them to breakout sessions, and that's really where the majority of the conversation will be occurring in these forums. Be happy now to answer any questions and definitely to take any ideas and comments that you might have at this time. Thank you very much.
Hi, Amy, this is Michelle. Do we know, like, the information that was gathered at the meetings? What were the highlights and what information was taken from the meetings?
So the dialogue at the meetings were, at the one meeting that I've held so far in those 6 breakout sessions, those did really center around
she must be having technical difficulties. Give it just a minute, maybe she'll pop back.
Hi, sorry about that. Is my audio back now?
Yes.
Sorry about that. So in regard to your question, we are analyzing those findings right now. We did get a lot of really good insights from those 6 breakout sessions, and we hope to have a full report available soon. We are working on understanding the feedback that was offered.
Okay, thank you.
Any other questions or feedback about the event that we held, as well as the ones coming?
This is Laura Magruder with Maggie's Place. I just wanted to give a shout out to all the staff that coordinated this. The sessions went really, really well. I learned a lot. It was good to hear from others that I wasn't the only one with similar frustrations. And so I really appreciated the opportunity to have a forum where we could have an honest and frank conversation about some of the challenges that we're facing moving forward with our clientele, but the staff did a great job putting this all together. I know it was a little wonky in the beginning with people that jumped in, including myself. I thought I had registered, but apparently not. So I appreciate that, but it was well worth the time.
Thank you. Thank you very much. Really appreciate that feedback. We, like so many others, are kind of venturing into Zoom and virtual meetings and learning a lot as we go. So I appreciate everyone's patience and flexibility as we're able to spin people out to those breakout sessions. But we're really thrilled to have that level of participation and are thankful for your support. Other pieces of feedback that we might be able to take into account as we plan the rest of the forums? Okay. Oh, it looks like internet went down at Save the Family, just not able to get back. So looks like there are internet issues perhaps throughout the region and different communities. So hopefully she's able to jump back in. If there are no other questions, that completes my report. I encourage you to reach out at any time with any additional questions or feedback that you might have. Thank you.
Thank you, Amy. Next, Michelle will talk about the next agenda item.
Yeah, so we'll go on to agenda item number 5, which is the update on the regional efforts to end homelessness. So as discussed at the December 17th, 2002 COC committee meeting, MAG was involved in the collaborative with partners seeking to apply innovative solutions within the region in an effort to better respond to homelessness. So right now, Amy St. Peter, MAG Deputy Executive Director, will provide an update on the regional collaborative partnerships and activities. So Amy?
Thank you very much, Chair and members of the committee. There are a number of really just excellent efforts underway to address homelessness, particularly from that regional level. Of course, there's very good efforts underway in the East Valley, the West Valley, certainly throughout the city of Phoenix, and then regionally through a number of partners, including the Maricopa Regional Continuum of Care, as well as MAG and our direct service to member agencies. So we do have a visual that we'd love to share with you so we can talk through this just a bit. This is a graphic that we've developed to really demonstrate at a high level an overview of the relationships in terms of addressing regional homelessness efforts. So you'll see the foundation for all of this work are those triangles right at the bottom of the screen. And so this includes all of you, absolutely includes the nonprofit agencies, the cities, the towns, the counties, other really important sectors such as healthcare and philanthropy. So when we look at these 6 regional entities, and there are more, of course, but these are the 6 regional entities that are coordinating right now through the collaborative. Each of us are really looking to our member agencies, our stakeholders, our constituents to drive the policy and the direction within each of these 6 entities. And then you'll see that very thin circle coming around us. That's really to demonstrate the coordination. So we're coming together because we are each addressing homelessness at that regional level. So at a bare minimum, we just don't want to trip over each other. You know, we don't want to compete with each other. Nobody has that kind of time or resources. So we do want to coordinate with one another though. So we're coordinating what we're doing. We're sharing information. A great example of that is the United Way. They are right now their strategic plan, and that will include homelessness. And so they're looking at what they want to do in terms of homelessness in the next, few years, 5 years, and we're looking at the same. And so we're sharing information, we're attending each other's focus groups, and then we're aligning our strategies where it's mutually beneficial and relevant. And so there's nothing that there's no control exerted over another. It's merely that coordination so we can work smarter together than we would be able to do so on our own. For all of us, all of our work really comes through this larger triangle here right in the middle. And that's working very directly with the nonprofit providers, business, philanthropy, civic groups, and then as well as the local governments. None of us can do our work without working very directly and intentionally, particularly with these stakeholders right here in the middle. So all of our efforts are really funneling through being vetted by these very important partners right here in the middle. Then all of that feedback comes out to generate those regional strategies and plans with the shared goal of helping people experiencing homelessness have better access to housing services and that really strong safety net. And that strong safety net or prevention and diversion strategies are very critical, particularly right now. They've always been important, but right now, of course, we're facing this impending wave of people who might become homeless for the very first time when the moratorium is lifted on evictions. And so we're bracing ourselves. We're preparing the system. We're wanting to really strengthen that pipeline to make sure that we can accommodate, we can serve people who will really need this assistance right now, as well as in the coming months. These next coming months will be critical, particularly as we look at if that moratorium stays in place or not. So there's a lot of different efforts underway right now. There's definitely enough work for everybody. And we're working very hard to do two things. One, to make sure that this work is coordinated, and two, that we can ensure that diverse perspectives are included in all of this work. Homelessness, of course, is not caused by any one sector, and it cannot be solved by any one sector. So we really do need this diverse outreach to make sure that we're incorporating the perspectives of all of our partners in these efforts. So I do want to pause for a moment and see if you have any questions, any ideas, any direction as this work unfolds. Okay. Just making sure I'm not frozen.
Jennifer.
Okay. Yes, Jennifer.
Sorry about that. This is Jennifer from Mercy Care. I appreciate this visual. I think just as of recently, I felt a little overwhelmed or a little kind of a little confused with all of the different efforts that are happening.
Mm-hmm.
You know, I'm involved in a lot of different calls and subgroups and meetings and committees, and I just feel like, you know, there's some overlap between a lot of them. And sometimes I wonder, you know, if the group I'm currently sitting in is aware of the work of the other group that I'm sitting in. And so I'm wondering if there's a way at some point to this graphic to add kind of some of the specific, like specific work groups or meetings that are happening within these partnerships, because I think that's where I struggle a little bit. So like you could have one work group, right, that has several of these entities involved, and a couple might not be involved in that specific work group. And so I think that's where I struggle. I don't know if anybody else has a similar experience, but.
No, that's a great point. Thank you so much. If there's additional groups that we can represent in this visual, we would love to be able to do that. So that's one part of your question. I think the other part of your question then is then being able to track the activities to make sure that we're not being overly redundant or redundant in an inefficient way. Sometimes it's good when different groups are kind of leaning into the same issue, because then we can have the benefit of each of their perspectives, but that only occurs if we are coordinating and if we're communicating. And so what I hear you saying, and please make sure this is your intent, is really to make sure that we're coordinating among all of these different groups, and that we're not leaving any gaps, and that we're not being inefficient in our work. Does that speak to your comment?
Yeah, absolutely. And I think like just kind of a third point there is, you know, that there's several maybe entities that are working on something. And so it would be nice if, for example, you know, Vitalists wanted to reach out to an existing group because they see that they're working on, you know, A, B, and C, and they also have an interest and want to get involved. So I think it's also a way to encourage participation and coordination when one group might not be aware of what's happening within another.
That's a great point, Jennifer. Thank you so much for sharing that. We do have plans to really expand and deepen the information that's available, at least on the MAG website right now. And so that might be one mechanism to help with that cross-fertilization. And so we'll be really taking a look at the format and the content of our homeless planning page that's on the MAG website, and really looking at how we might be able to expand that information. And I think, to your point, being able to cross-fertilize, be able to offer up and connect the different groups working in that space can be a very important purpose for that redesign.
Great, thank you so much.
Sheila Schuster
sorry.
from Community Solutions, and I just have a few questions about where some different system level things fit in, and it might just be my understanding on looking at this, but like specifically, I was thinking about things like child welfare and like a lot of the prevention resources that are out there, like through like the community action programs and things like that. And then also the other one that I was wondering about was like the McKinsey-Vento liaisons on the school system. I know that they participate in the committee and stuff, but I almost wonder how they might fit in to some of the structure.
That is a great question. Thank you very much. And to your point, we haven't specified the different systems level work like that. That's really that deeply impacts the access that people have to assistance. We are in the process right now of interviewing for a systems level planner here at MAG, and we hope to be able to bring somebody on very specifically with that, not just that expertise, but also that focus. We do, of course, have staff on board right now who have expertise in the different systems, but we really want to carve out that space and that role for someone to focus exclusively at that systems level. And so we're hoping that that really enhances our efforts. And you're right, I think you've got a great point. I think that we could certainly do more justice to the systems level planning that and make sure that it's represented visually as well as tactically in our efforts. Thank you for that.
Thanks.
Hi, Amy, this is Michelle Jameson. One of the things is just as far as like with communication and getting the information out regarding who's doing what and the different types of groups. In the past, Meg would send out a weekly newsletter, just updating the providers and everybody, like this is what's happening this week. These are the groups that occurred and just giving brief updates. And that was really helpful in the past. And I'm not sure if we could bring that back.
That's a great point. I love that idea. I know that we used to have more electronic newsletters go out through the Human Services Division and just even a weekly update. Right now, we do have very detailed weekly updates going out to some of our partners, but I think a broader distribution for the highlights, I think could be really effective. And that's absolutely something that we can take a look at and see how we might be able to roll that out. That's a very good idea. Thank you.
And Madam Chair and Amy, if I may add to that response, I know that's something that the CFC team has been meeting about and discussing as well. And so we are actively pursuing distributing at least a monthly newsletter summarizing the efforts taking place throughout the continuum of care, and then also looking at options to provide those weekly updates as well. So that is something that we're actively working on, and we'll be getting something rolled out very soon.
Thank you, Brandy. Excellent. Other questions, other comments, other direction?
I just had a quick question or thought. I mean, I know that Arizona Housing Coalition obviously does a lot of advocacy on the state level. And I know over the years, several cities have taken on their own kind of homeless czar position. My question is, where is the governor's office in this plan to coordinate a systemic, system-wide approach to ending homelessness?
That's a great question. This is focused at that regional level. The governor's office would certainly be a partner within that. But there may be an opportunity, particularly when you're talking about the systems level. I know that was a comment just previously offered as well. We might be able to build something in more specifically about connecting this to the different systems, including the governor's office and those statewide activities. The focus for this one is really at that regional level, but that doesn't preclude the statewide services and activities that are broadly available as well. Thank you. Any other comments or questions?
I was going to ask that too. Okay, I think then, so thank you, Amy. And now we will have Stephanie introduce the next agenda item, number 6.
Thanks, Michelle. So next we will have DC Ernst from Phoenix Fire Crisis Response. She will provide an overview of first responders, provide crisis response to those experiencing homelessness.
Good morning, everyone. Madam Co-Chairs, committee members, and MAG staff. I appreciate the opportunity to come to you today and talk to you about what we're able to provide as far as crisis responders. So when I was asked to present today, I decided, well, I should reach out to my partners in the other cities and see if there's anything specific that they would like me to bring up in this meeting. And I heard back from a few of them, and in all honesty, we've all been extremely busy lately with COVID calls and other things. So I wasn't able to get as much detail as I had hoped, but I hope the information I provide is helpful. So there are several cities within Maricopa County that actually have crisis response programs: Surprise, Chandler, Glendale, Gila River Indian Community, Phoenix, obviously. And then there are and Tempe, sorry. And then there are other cities that have programs that I don't have as much information about. Like I know the city of Scottsdale utilizes their victim advocates to respond out to calls. And in Mesa, they have a couple of different types of responses. The one that I'm most familiar with is directed towards responding to individuals who have mental health or behavioral health issues and that are utilizing 911 in a way that it's not intended. So I wanted to just give you a brief overview of the staffing for the majority of these crisis units. We rely heavily on volunteers and interns for most of our staffing. In Phoenix, that's 50% of our staffing is volunteers and interns. In other cities, it varies at the level that they rely on volunteers. Majority of us, our teams are staffed utilizing 2 people. Tempe is the only team that I'm aware of. They have full-time staff that if they do not have a volunteer that is available to work on the unit with the full-time staff member, that staff member will still go into service and respond as an individual person. Pardon me. I am also aware that other cities are trying to develop or redevelop programs that they've had in the past. Most of the cities, we offer our services 24/7, 365 days a year. Staffing, of course, dictates how available those shifts are, those units are. Funding also determines how the units respond. So specifically in the city of Phoenix, we have city funding and we have grant funded positions. So I have currently 2 unit staff that are grant funded through the Victims of Crime Act. So those units, they're required to respond to calls where a criminal investigation is being completed. And then I have 2 units that can respond to non-crime related calls, such as issues surrounding homelessness. And again, because 50% of our staffing is volunteers, I'd say the majority of our staffing is also part-time employees. Out of our 30 odd employees, I have 7 full-time staff currently that work on or that will be working on a crisis unit. The others are all part-time positions. Training has been developed over many years. So there's actually a regional crisis interventionist training academy. It's a long title. It was developed over 15 years ago, and it actually started through MAG's domestic violence committee, where they were trying to ensure that people who were responding to domestic violence calls were doing a unified response or best practices when they responded. So over the years, the regional training has changed, and it's much broader, the information that we provide. The cities that I mentioned before, a lot of them participate in sending their responders, new responders to this training. It's over 11 hours worth of training, specifically for regional training. And then each city does their own individual training on top of that. And then there's also online training and the field training. The level of education for paid staff varies between cities as well. It can be anywhere from having a high school diploma to having a master's degree and being a licensed behavioral health specialist. So in that regional training where we collaborate with other community agencies, so we've collaborated in the past with the Crisis Response Network, Community Bridges, the Coalition to End Sexual and Domestic Violence, the Area Agency on Aging, and some of the training courses are basic Crisis Intervention 101, as well as trauma-informed response, mandatory reporting, victim advocacy, substance abuse, and mental health, and how to work with individuals dealing with those issues. I apologize for looking down at my notes. The challenge for us in reporting, specifically in Phoenix, reporting how many individuals experiencing homelessness that we encounter is, one, in the city of Phoenix, we don't have electronic records yet. So all of our information is still documented on paper, and the information that we do collect in an access program essentially is really focused on meeting our grant requirements and being able to report out to our grant. So when we get called out to assist people, we are automatically dispatched out through the fire dispatch, along with Chandler, Glendale, Surprise. They're all dispatched out through the regional dispatch system. That system has specific, what they call nature codes that you can be dispatched out on. Homelessness is not one of them. Typically, these calls come out for us as either a medical issue, an assist PD, something like that, where it doesn't specifically identify that the reason we're being asked to come out is due to homelessness. So when we collect the data from our responders, what we ask them to do, since we can only collect one primary problem, is what was the primary issue that you were helping that individual with? So if they were called out and the issue was substance abuse, but the person is also experiencing homelessness, then we're going to be documenting that as we assisted them with substance abuse and getting them into some type of program related to that. If they're homeless because of a domestic violence issue, we're documenting it as a domestic violence issue and not as a homeless issue. So, for instance, last year, I pulled my numbers, and in Phoenix, we showed that we were on 51 cases where homelessness was identified as the main issue for the primary problem that we were working with someone with. Other cities do utilize electronic records. They are able to capture that information better and to be able to document and provide that information out to their cities about who they are actually helping and what primary, secondary issues that their clients face that they assisted with. All right, let me just try to, I put a timer on myself. Let me make sure I'm on track here. So some of the struggles and opportunities for change that we have identified is the fact that even the cities that have electronic records, they lack the ability to get into the health information management system. So they're not able to collect or access information right there on the call that can assist them in determining what services is that individual already receiving, where are they connected, and how can we reconnect them to that service. What we find is that oftentimes the individuals that we encounter are not the best recorders of their own history, medical history, who is their case manager, who are they connected with. Sometimes people have cards with them and we're able to utilize that to try to reach back out to them and back to the people that they're working with. But oftentimes they can just say, hey, I've been working with Sarah, but they can't tell me who Sarah works with or a way to contact her. The other issue is a lot of times we come in contact with these individuals after hours. And it's really hard to find services for them after hours, including shelter. It's become more and more challenging to find shelter for them throughout COVID. Summer times are hard. Actually, it's just hard all year round for us to be able to find emergency shelter. And then when we do make suggestions, such as going down to the campus, a lot of them have tried that and they've indicated that that wasn't successful for them in some way, shape, or form, and that they would prefer a different route to get services. I believe that's basically a summary of everything that I collected and that I wanted to share with you. So I'm just going to open it up to questions. And again, I appreciate the time and I'm sorry for the discombobulated presentation of the information. Thank you.
DC, this is Michelle Jameson. I thought you did a great job, and thank you for sharing the program and the information with us. Do you know on a given month like how many people you're able to serve?
Monthly, I actually don't have that number. And in fact, I don't even have the numbers for how many people we served last year. I can tell you that we go out on like 5,000 calls a year. And on average, we probably hit 2 to 3 people per call. So.
Thank you.
We are actively seeking volunteers. So if any of you are bored and are like, I really want to do this on my off time too, all the cities are always accepting applications for volunteers. So please feel free to contact me and I will get you in touch with whatever city you'd like to volunteer in.
Madam Chair, this is Steve from the COC. Can I ask DC a question?
Of course.
Thank you. I appreciate it. Hi, DZ. Thank you for your presentation. I'm just wondering, given you're a part of the Phoenix Fire Department and doing this wonderful response, what does the partnership or intersect look like with local law enforcement for these calls? I just want to get some clarity around that and learn a little bit from you with your partnership with law enforcement.
I appreciate that question because it did remind me, I left off all of the collaboration that we do with both law enforcement, fire department, and our community members and community partners. So specifically in Phoenix, the City of Phoenix Police Department has a group of their members that are crisis interventionists, that are CIT trained. They tend to have more skills at dealing with individuals who might have behavioral health issues. They're more social worky, if you will. And then they connect individuals specifically with community bridges and with the crisis response network. As a city, we are in discussions about how do we utilize the CR program better with Phoenix PD and with Phoenix Fire to meet the needs of these individuals. Our program still reaches out to the crisis response network when we come across someone who expresses harm to self or harm to others. We work with Impact, with Teros, with community bridges and others to try to meet the needs of individuals who are in crisis. And we're still trying to collaborate with even Phoenix Cares. I had a meeting with them earlier this week to start looking at how we can collaborate more to make sure that we're not duplicating services or that we're communicating. My program is communicating back to them who we're working with so that they know that that individual was touched by another entity. Phoenix PD is able to reach out to us through our alarm or dispatch system. So they contact their dispatch, contact our dispatch and says, hey, do you guys have a CR team available? And if we do, then we are dispatched out to assist them. Again, the majority of the time, the calls that we work with PD are really crime-based. Like I said, I was actually really surprised to see that the number of homeless calls that we had was 51. That seemed low to me, but again, it could be because my teams do document it if they're working on a different issue. Hopefully that answered your question.
I appreciate it. Thank you, DC.
Any other comments or questions for DC?
This is Laura Magruder with Maggie's Place. I just wanted to do a shout out. I know that seems to be my word today. I'm happy with everybody. I know DC did it with securing interns, but I cut my teeth on this program decades ago. And I really, truly believe it's the foundation of how I run Maggie's Place and being out there and hands-on. I did work with both fire and law enforcement quite a bit, and I loved it. It was the best training I could have ever asked for. And I just highly encourage the other organizations on the line and those with MAG that if you know anybody that is finishing up or working on their master's and looking for an internship, this is an amazing opportunity, and you really do, if you're have any inkling of going into the social service sector, you'll learn very quickly if it's for you or not if you do this kind of work. So kudos to the program for going, and I just say share the word. It's an excellent way to really learn the intricacies of human nature and those living on the street.
The other thing I'd like to offer is if anybody on the committee would be interested in doing a ride with our program. Now is a little challenging with COVID. You put yourself at risk, like all of our responders have continued to do, and I praise them for the work that they do, because despite COVID, they continue to show up for work, and they continue to offer these services to our community members, and are finding creative ways to, even when we go out on calls where the person has been identified as COVID positive, to make sure that that individual receives the care and the services they deserve. So if you are interested, we are challenged because we are limiting the number of people who are riding to limit the COVID exposure. But if you'd ever like to do a ride with any of our units, please let me know, and I'd be happy to see if we can set that up. We do 12-hour shifts. We have one unit that does 8-hour shifts. So my teams also work 12 hours to 24 hours a week or more. So they're very dedicated, both volunteers, paid staff, and interns. And I have to say, it's really an honor to represent them whenever I can, anywhere I can.
Anybody else? So fun fact, I am a CR volunteer, and I absolutely love going on my shift. Tanya's a little mad at me right now, DC, because I've been laying low because of COVID, but I'm still here. And I don't want to speak for DC, but I think, so on each of the vans, there's a resource binder with different programs, flyers, or information. So I don't want to speak for DC, but I'm sure if you wanted to send any flyers on your programs that you think might be helpful to responders or the people that they're assisting, I'm sure they would welcome that.
Thank you, Stephanie. We actually have a committee. We actually have a committee together right now looking at all of our resources, because we have a small space, just one little box with all of our resources in it. We have a 3-ring notebook that's 3 inches thick with a ton of other resources. But if you do have something, please submit it to us. We'd be happy to look at it. If we can provide it, we definitely will. Otherwise, we might just put it in a written document in our binder so that our responders know. Typically, what our policy is for every issue that the individual has identified as a need, we try to provide 3 resources for each of those issues. So homelessness, we provide obviously the Housing Hub phone number and some other resources. Grief counseling, we provide resources as well. So we try to be fair across the board to our community members and all the agencies out there to make sure that we're spreading the wealth of getting them clients as well.
All right, thanks again, DC. If nothing else, I will hand it back over to you, Michelle.
Thank you. And so now agenda item number 7, Sarah Kent, the MAG and COC Human Service Planner, will talk about the January 4th COC board meeting. Sarah?
Great. Good afternoon, Madam Chairwoman and members of the COC committee. I'm Sarah Kent, Human Services Planner with MAG and the Regional COC. And I'm here to provide an ongoing update on the COC board, of course, to create synergy with you folks in the COC committee. So I want to first invite every single COC committee member to watch the COC board meetings every month from YouTube. The COC board meetings are generally the last Monday of every month from 1:30 to 3:30 p.m. with a couple of exceptions in there. And you can watch all past meetings from YouTube that are posted on the website, and all of our future meetings are also posted. on the MAG website. So you're able to watch some of those or all of those board meetings rather at your convenience. So the first item that was heard on the agenda was an excellent presentation titled Forecasting Homelessness by Dr. Keith Bentilli, who is an associate research professor at Southwest Institute for Research on Women at the University of Arizona. Dr. Bentilli provided an overview of various indicators of housing insecurity and potential resulting increases in homelessness in Arizona. Quite fascinating. So check that out. The second item that was heard on presentation was also a wonderful presentation from CJ Hager, Director of Healthy Communities at Vitalist Health Foundation, on responding to the eviction moratorium while addressing homelessness. Vitalist Health Foundation and Virginia G. Piper Charitable Trust are partnering with local community agencies to address the eviction crisis and make critical services available to those in need. Next, the COC board is having a strategic planning retreat that will take place this Friday, January 15th from 2 to 4 p.m. And then our second will be January 22nd from 2 to 4 as well. The COC board members were sent a survey that asked questions around what outcomes, data, outputs, training topics, external stakeholders that they might want to have for part of the event, as well as possible survey work that they might want from stakeholders prior to the retreat. As well as we solidified the date and time frame. Board members were given a summary of the survey results that informed the agenda for the strategic planning sessions. The other topics that were discussed at the last COC board meeting was an update on regional efforts to end homelessness, which MAG's Deputy Executive Director, Amy St. Peter, just updated all of you on. Thank you, Amy. Lastly, the COC board received a presentation on MAG's role in addressing homelessness. On December 2nd, 2020, the Regional Council requested information on MAG's role in homelessness planning. The intended outcome of the document was to clarify roles and to build consensus for strengthening the regional strategies that will move people from homelessness to housing. You can find all the board materials on the MAG website, as mentioned before, for more details on everything that I just mentioned. And you can also reach out to Steve or myself for if you have any questions, or I'd be happy to send the material to you directly. And that, Madam Chairwoman, it concludes my presentation on the COC board, and thank you all very much for your time.
Are there any questions from the committee for Sarah? Okay, so we will move to agenda item number 8. Stephanie?
Okay, next agenda item is request for future agenda items. So do any committee members have any action or discussion items for our February meeting? I know one thing I would like to add to the agenda would be to get an update from the board strategic planning session.
Well, and I had a question. I saw that the Continuum of Care registration went out yesterday for housing and urban development, and I was wondering if you all have a timeline for the next NOFA round?
Madam Chair, members of the committee, if I may respond to that, I know that there were some conversations among my team yesterday in response to that email from HUD. So looking to Julie or Steve, if you can provide an update to the committee on the email that came out and our next steps regarding registration.
Yes, Madam Chairwoman. This is Julie Montoya with MAG. We did receive that information as well. I believe the deadline for registration is February 4th, and the guidelines for that will be coming out this Friday. So we will ensure that we're registered for the 2021 NOFA.
I was also going to bring up that maybe we should look at the scorecard and and put that on agenda item as well.
Thank you. We will make a note of that as well. Thank you.
Any other action or discussion items committee members would like?
I just had one other question, since the topic really has been on the focus of really planning. And I know the Treasury is going to be issuing a lot of funds related to eviction prevention. And I'm wondering how that ties into the regional plan.
Can you repeat that question again? I just want to make sure I understand all aspects of that. You're talking about the Treasury?
Yes, the 25 million that the Treasury Department is going to be issuing to various governments and municipalities for eviction prevention and utility assistance. And I was just wondering how that played into the regional plan for reducing or preventing families coming into, or individuals coming into the homeless system.
Okay.
Has there been any community strategic thought on how those are going to roll out?
You know, I think that we'll need to do some additional research on that. Perhaps that could be an item for the next agenda, if that's all right. Great, thank you very much for that. And I just want to make sure that we're fully answering your question when we circle back with you. So the question isn't maybe so much about the regional plan, it's more so about what's the regional coordination that's underway right now to address this additional funding, is that correct?
Yes, that's correct.
Okay, excellent, thank you very much. We will circle back with you at the next meeting on that question.
This is Daniel Davis from UMOM. National Low Income Housing Coalition has put out a few reports on the most impactful implementation of that funding. I know they just published another one maybe 2 days ago, so that might be a good place to start.
Excellent, thank you. We will certainly look into that as a resource.
Well, and Amy, I just want to correct, it's 25 billion nationwide that's going out, but I know that there's quite a bit, I think about 25 million coming into Arizona.
Perfect, thank you. Yes, that would be substantial, definitely.
And maybe if we can just have a information or presentation, or have committee members be prepared to talk about how just different resources that they're aware of around eviction prevention. It's going to be a huge issue for our committee once that eviction moratorium is lifted. And so I feel like we just want to make sure that us as a community have all the resources available to us.
Anything else from committee members? Oh.
Yeah, sorry, Stephanie. Just a standing item, I think, too, is just updates from the subcommittees. And then maybe also, maybe just, I would appreciate like a verbal on the racial equity and things around that work group as well.
Anything else from anybody? All right, hearing none, I'll hand it back over to Michelle.
And just, is there anyone for the committee? We just want comments from the committee, any events or any highlights that anyone would like to talk about or share with our group?
This is Stephanie Smith. I have one. We are getting ready to finish up construction for our newest PSH housing community in the Sunny Slope area. So that project is called Dunlop Point. It consists of 54 single occupancy units, very similar to our other PSH projects if you are familiar with them. And we should be able to start housing people by the end of this month. So we're in the home stretch.
That's awesome. there anything else or? I did want to just say, and I'm not sure, John Wall from the Arizona Housing Arizona Housing is retiring. So I'm not sure if people are aware of that. So many of the people that have worked in this have worked with John. And so he's a great individual. I've personally learned a lot from him and I wish him well. And I wish I could retire too. So I'm a little jealous on that aspect, but I did want to just acknowledge his retirement.
He's been a huge advocate, especially for chronically single homeless. So
yeah,
it's a great loss, 25 years.
It is, yeah. And he's just an amazing individual. So
You can tell him to come volunteer for the City of Phoenix Fire Department. That'd be great.
DC, you have gotten in some really good volunteer opportunity plugs today. So
I appreciate you. Thank you.
All right. Well, if there's no other announcements, we are adjourned. And please have a good day and a week as well. So we will see you next month and have a good day.
Take care, everyone. Bye-bye.
Bye.
Bye, everyone.
Thank you.